Invasive or non-invasive ventilation, what's the difference? Choosing the right support is critical for patients in respiratory distress. We must evaluate the patient's stability and airway protection before deciding. Let's break down these two life-saving respiratory interventions used in the clinical setting.
Non-invasive ventilation uses masks like CPAP or BiPAP to deliver positive pressure without inserting an artificial airway. In contrast, invasive ventilation requires an endotracheal tube or tracheostomy directly connected to a ventilator. This direct access allows for total control over the patient's breathing cycle and gas exchange.
Invasive ventilation is utilized when non-invasive methods are not enough to maintain oxygenation or ventilation. Nurses must monitor for signs of NIV failure, such as patient exhaustion or worsening blood gas levels. Always remember the rule of thumb: mask first if possible, but use a tube when necessary.